Yeah, that's right. Cool.
Hello everyone, I'm Daniel and today is National Doctors Day, right?
Yes.
And we're here with a very special guest. You may know her as Miss Universe Jamaica 2023, but I'm introducing her today as Dr. Jordanne Lauren Levy. And we're here with a special conversation, or interesting topic rather, safe sex. Right.
Let's
right to it. Okay, so Jordan, the first question that I want to ask you is, what are some of the most common STIs that Jamaicans would have contracted or would contract?
So I like to categorize these STIs as curable and uncurable.
Right.
Because it's important to just get that out there. A lot of persons are unaware that you have STIs that are uncurable, and when they do receive the diagnosis, it's devastating. So you're uncurable. We know HIV, genital warts, otherwise it's known as herpes. Syphilis, uncurable. Right. And you're curable, you have chlamydia, gonorrhea, to name a few.
Okay. Alright. And have you ever treated STIs before as a medical doctor?
Yes, I have, in fact, and it's something that, boy, when you're in that room and you get that diagnosis and you're with the patient, it's obviously life-changing, especially when it's something that is uncurable.
Yeah, and sometimes you have to deal with also the psychosocial aspect of it.
The psychosocial aspect, I think, is something that we need to just have a conversation about. Right. And just knowing that prevention is better than cure, and equipping yourself with all the knowledge helps you to prevent contracting these STIs and spreading these STIs. And so we want to just take that taboo out of sexual health.
And do you believe that people should feel ashamed, when they contract STIs?
Absolutely not. Absolutely not. There's no shame in knowing that something has happened to your body. If you have an infection anywhere in your body, you want to treat it. So there should be no shame, and that's why we want to take the taboo out of it. Talk with your sister and talk with your brethren. Open up the conversation about sex and safe sex, and the different signs and symptoms of these STIs and how we can see them, notify our partner about them, and prevent them.
Okay, and what do you know about STI treatment here in Jamaica?
Well, first of all, education.
Right.
Sexual health education is important.
So true. And awareness. It's a part of the awareness aspect as really education.
Absolutely. Right. So a lot of times when patients are in the clinical setting, they're so unaware that this could have been contracted by just touching.
Right.
Genital warts can be contracted. Human papillomavirus. These are things that we want to spread the message about, that you don't have to have penetration to get an STI.
So true. Okay, and do you believe that Jamaica is doing enough, to reduce, the contraction of STIs in our country?
The Ministry of Health and Education is doing an excellent job. However, I want to do my part to just spread that awareness. As young people, we need to educate, we need to talk about it, and not be so stiff about it. Just know that this is a part of life, and safe sex is a part of life. And once we have safe sex conversations, we can have a better society. Right?
Agreed. 100%. 150%. Yeah, so the final question that I really want to ask you is, do you believe that us as citizens are doing enough, and what can we do if not, in terms of making sure we protect ourselves from STIs and STDs?
Getting screening done is very important. So you have primary screening where you go and get your checks.
Right.
Get your STI checks, HIV checks. Know your status.
Yes.
Right.
All the time.
Know your numbers. Know your status. It's very important. The Ministry of Health and Wellness, they have an excellent program out now to know your numbers, and know your status is a part of it. So they're going to various parishes across Jamaica and ensuring that people know what their health status is. It's important that you know, so you can treat and prevent.
Wow. Guys, you heard it. You heard it from the one and only Dr. Jordanne Lauren Levy. And I just close to say, make sure to use a condom all the time, because it's very important.
Very important.
Right? And always, as she said, know your status. Right? So every 3 months,
Every 3 months
Mhm.
is excellent, at least
Right.
once a year.
Yes.
And once you know that you're in a monogamous relationship,
Mhm.
you want to have these conversations with your partner about STIs and make sure that you are in a condom.
Okay. You heard it, Jordan. Thank you so much for your insightful input.
Thank you so much for having me.
Yes, thank you so much.
Daniel.
All right, so that's a wrap.